The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. This video demonstrates standard parts of a wheelchair and how they should be utilized to maximize safety when transferring a patient into or out of a wheelchair. There may be some slight variations in different wheelchairs in terms of how the levers and buttons are operated to manipulate the various wheelchair parts. But the concepts presented in this video can be generalized to many types of wheelchairs. Overall, wheelchairs with removable or swing-away leg rests and armrests are the most versatile and ideal for safe transfers. When assisting a patient into a wheelchair, there are two steps that can be done in preparation: removing the leg rests and removing the arm rests. If you are unsure about the patient's sitting balance, or if you know they have difficulty with sitting balance, I recommend completing these two steps while the patient is still lying safely in bed. Ideally, leg rests are swung out to the side and removed so that they are out of the way during the transfer and therefore don't have the potential to trip up the patient or the caregiver. Removing, or at least swinging the leg rest out to the side, allows you to position the wheelchair closer to the surface that the patient is transferring to or from, and provides more space in front of the wheelchair for feet, both yours and the patient's, during the transfer. To swing away the leg rests, a pressure lever will be located directly above the front wheels. Depending on the particular wheelchair, you need to either push or pull on the lever to unlock the leg rest so that it can be swung out to the side. If removing a leg rest from the wheelchair frame, simply pull up firmly on the leg rest once it is swung out to the side. When performing a transfer, it is recommended that at least the leg rest closest to the surface to or from which you are transferring be removed and the opposite one swung away. Other features of a wheelchair that can be used to maximize patient safety are the armrests. Armrests provide a nice, sturdy surface with which the patient can assist themselves in attaining a standing position. They also provide feedback to a patient that they are close enough to the chair to sit down, assuming that the patient reaches back for the armrests as they move into sitting. However, armrests can also be problematic for some patients. If the patient is unable to come up into a complete standing position, the armrest closest to the surface to or from which the patient is transferring should be removed if possible, so that it does not become an obstacle during the transfer. This would be important if you are doing a squat pivot transfer or using a slide board. To remove a removable armrest on most wheelchairs, press a pin lock near the seat of the wheelchair and simply pull up on the armrest to remove it from the wheelchair frame or swing it out of the way. Once I have these initial steps done and the wheelchair is within my reach, I can assist the patient into sitting. Because the leg rest nearest the bed is removed, the wheelchair can be placed immediately adjacent to the bed. The wheelchair should be positioned parallel to or at a slight angle to the bed prior to initiating the transfer. Having the wheelchair within your reach prior to helping the patient into sitting allows you to finish positioning it while keeping a hand on the patient to assist with sitting balance if needed. The next extremely important step is to make sure that the brakes are locked before moving the patient. If the brakes are not locked, the wheelchair has the potential to roll away as you move the patient into it. Most standard wheelchairs will have a small lever that serves as a brake mechanism. It is usually located just anterior to the back wheels on both sides of the wheelchair. Now, the patient has been transferred into the wheelchair, and the video will show how to put the wheelchair back together so that the patient can be transported or sit comfortably. Remove or at least loosen the gait belt. To replace a leg rest that has been swung away, simply pull the leg rest back around to the front and click it back into place. Make sure the leg rest is locked into place by giving it a slight shake. To reattach a removable armrest, simply push it back into place. You'll notice in the video that I have the patient temporarily place both feet on one footrest so that I can move the wheelchair away from the side of the bed. This helps make sure I won't injure her foot while moving the wheelchair. It is necessary to have room along the side of the wheelchair to reattach the leg rest that has been removed. To reattach the leg rest onto the wheelchair frame, line up the holes on the leg rest with the small nubs located on the wheelchair and push down. This must be done with the leg rest angled slightly to the side, which is why I moved the wheelchair away from the bed. Once initially placed, the leg rest can be swung around to the front of the wheelchair and clicked into place. If the wheelchair does not have leg rest that can swing away and/or can be removed, flipping the foot plates up into a vertical position is a minimum step that needs to be taken to clear the way for the patient to place their feet on the ground during a transfer to and from the wheelchair. Most standard wheelchairs have foot plates that can be elevated from a horizontal to a vertical position. To elevate the foot plate, simply pull it up. To move it back into a horizontal position, simply push it back down. Lastly, if the patient is going to remain in the chair after you leave the room, for fall risk reduction, ensure that personal items and a call light are within the patient's reach and set a chair alarm if indicated for that patient. It would also be appropriate to remind the patient to call for assistance prior to getting up from the chair. Now, the video will show wheelchair management in reverse as the patient moves back to bed. First, I will swing away and remove the leg rest so that I can position the wheelchair as close as possible to the bed for the transfer. Again, I have her place both feet on one footrest to prevent injury to the foot. The wheelchair is positioned adjacent to the bed at a slight angle or parallel to the bed, and both brakes are locked. The opposite leg rest is swung out of the way, and finally, the armrest closest to the bed is removed. Again, if you anticipate that the patient will be able to come to a full stand for the pivot back to bed, you do not need to remove the armrest. Moving the leg rests out of the way and positioning the wheelchair adjacent to the bed, as shown in this video, minimizes the distance that the patient has to travel during the transfer, which maximizes safety. Moving the leg rests out of the way also prevents the leg rests from becoming a trip hazard for you or the patient. Sometimes it might be tempting to simply elevate the footrests, assist the patient to standing, then have a second person move the wheelchair out of the way before the patient turns so that no one bumps against the leg rests. The only time this strategy might be appropriate is if the wheelchair has fixed leg rests, meaning that they cannot be swung away or removed. Leaving the chair in place during the transfer is preferred because it provides you with a safety net in the event that a patient begins to fall during the transfer. You can control their descent onto the bed or back into the chair, whichever surface they are closest to, rather than having to lower them down to the floor.